Today I'm going to talk about CPAP, BiPAP, how to keep things clean, disinfected for your overall health. So all machines are a little bit different, but essentially they have a humidifier chamber. They have the machine that either provides the constant or intermittent air supply, tubing, and also a filter. So the filter should be replaced monthly if it's a non-washable kind. If it's a washable kind, that can last 3 to 6 months. The humidifier chamber, you want to make sure to open this up and empty it daily. You can use daily if needed. Some baby shampoo and then rinse it well. Once a week, the recommendation is a vinegar water mixture of 1 part vinegar to 2 to 3 parts water. Let it submerge. Only the humidifier chamber goes in the water for 30 minutes. You want to make sure you rinse it well after that, so soak it in regular tap water for an additional 30 minutes and then rinse everything with distilled water to avoid calcium droplets and so your items last longer. And again, you want to be checking this often. I went into a client's home where they didn't know about their humidifier chamber. The daughter was filling it for them, and there was actually slime and sludge in this water chamber that they were breathing in. The other thing is, I went to a client's home. He had a CPAP machine for 2 years. They didn't know there was a filter. And it looked like it was about 5 filters thick, full of dust and so forth. So it's very important for your overall health to change these regularly. And then your tubing and your seal. Most have the seal that can come off of the headgear, and you want to replace this anywhere from 1 to 3 months depending on the type that you have and what your insurance pays for. Typically, the tubing, the headgear, insurances will pay for these to be replaced every 6 months. Check them often for little cracks that can happen here, and also the end that goes into your machine, because if there's air escaping, it's not working well. And also wash your headgear often, because this gets stretched out, and then you'll have leaking from your mask and air blowing up by your eye and so forth. If you cannot tolerate a mask or a CPAP machine, there are alternatives that a dentist can do for you if they're a specialist dentist for an oral sleep apnea appliance, it's called, where they do a test on you. You're not able to tolerate this, so they can make you an appliance, and then your insurance will pay for that. It does make your bottom jaw go forward some, so it has a potential of altering your bite. So there is a potential that you may need to have corrective surgery down the road. I've only known of 2 people that needed that out of 100, so chances are pretty slim. The other thing to remember, I know it's a nuisance, but Reggie White, a Packer player from years ago, he had sleep apnea and he did not wear his machine, and he died because of it at a very young age. So they found studies, and if you do not wear the sleep apnea mask or the oral appliance, it takes 8 to 10 years off of your life. It causes cardiac issues, it can cause diabetes, and it can also, they believe there's a link that it can affect your short-term memory. So again, I understand this is a nuisance to wear a CPAP, but for your overall health it is very important. Don't just give it 2 days and give up. It takes a month to 2 months to be adjusted to any type of headgear. So just keep plugging along, keep trying. If after several months it's still not a go, then speak with your respiratory therapist about the oral appliance, and they can direct you to that type of dentist.